There is a lot of stigma surrounding mental illness. Oftentimes, people with mental illness are perceived to be dangerous, incompetent, or crazy, among other negative attributes. However, these characteristics are often very untrue. For example, violence is not at all characteristic of schizophrenic people. It is important to examine stigma because stigma is the primary barrier to wellness and recovery. In addition to society's stigma, there is also an internalized stigma. Insight and awareness of schizophrenia leads to better care for the illness. However, it also leads to an increased risk of depression and lower quality of life. This is because people who are aware that they have schizophrenia often question who they are and struggle with what this new world they are seeing is. It can lead to depressed feelings of not knowing oneself. On the other hand, lack of insight leads to worse care because people are not seeking the treatment they need. Therefore, poor insight is a barrier to one's wellness. The major question is, how does one combat the stigma towards schizophrenia? It has been often thought that a neurobiological understanding of the illness would decrease stigma. This way, the mental illness is presented as a physical disease. While the public embraced this view and it led to increased odds of endorsing treatment, it did not actually decrease stigma. In studies from 1996 to 2006, it was found that there was a 10% increase in public embracement of a neurobiological understanding of schizophrenia. However, there was still not a decrease in stigma. For example, 62% were still unwilling to work closely with a person with schizophrenia, or 52% were still unwilling to socialize with a person with schizophrenia. So what would actually reduce stigma? Studies have found that people who have had personal experience with mentally ill people perceive them as less dangerous. We need to promote contact between the public and people with mental illnesses. Education is key to reducing stigma. However, it should be noted that the description of symptoms alone does not help reduce stigma because it can create further fear towards mental illness. Many famous people have been known to have schizophrenia. For example, the lead singer and songwriter for Pink Floyd, as pictured to the right, or John Nash, the main character portrayed in A Beautiful Mind.